Hello everyone, my name's John. This is my journey with stage 3 melanoma and interferon treatments. How'd this whole thing start? Back in early May 2013, I noticed a mole on my back, probably big as round as my pinky, and stuck off maybe that far, quarter to an eighth inch. It had been growing there for a while, maybe 6 months or so, and it was starting to get to the point where every time I sat down in the car it would get irritated and sore. So I went to the doctor just basically to get it removed. My primary care physician referred me to a dermatologist. Both of those people said, hey, this doesn't look like a cancer, it just looks like a polyp. We'll just have it removed and that'll be the end of it. But standard procedure was that everything that gets removed goes and gets biopsied. Fortunately, when the biopsy results came back, they found out that it was cancer. That's the scariest thing that's ever happened to me, by far. They told me on a Friday evening, 5 minutes before I had to start my shift at a local restaurant. It was difficult to work that night, but I'm a little bit glad that I had to work because it kept my mind busy and kept me from worrying. Let's see. What happens after you find out you have cancer? Well, with my melanoma, the first thing that happened was I was referred to a surgeon, and the first surgery was called a wide excision. Basically they go and take out an area around where the cancer originally was and then sew everything back up just to make sure they get all the cancer. During that same surgery, they also took a sentinel lymph node biopsy. What happened was I got a PET scan. I wasn't allowed to eat or drink for 12 hours before this. So they go in where the cancer originally was and inject a radioactive dye and see where it goes in your body based on your lymph nodes. Let's see. When they did that to me, there was actually sentinel nodes on each side of my chest that were removed during that surgery. Just one of each. Then after that surgery, we'd wait a long time for test results. After that, those test results came back. It showed that I had cancer on both sides of my chest in the lymph nodes, and we had to go in and do a full lymph node dissection on each side of my chest. So they took all the lymph nodes out from underneath my armpits. That was a very time-consuming surgery. It was an overnight stay in the hospital, which I'd never done before. Tell you, if you've never stayed the night in the hospital before, don't expect to get any sleep. Let's see. Then following that surgery, I ended up going home with JP drains under each arm. Basically what it does is it takes all the lymph, all the fluids that your body would be sending to those lymph nodes and drains them out of your body into a little bulb about the size of a tennis ball. I had those drains coming out of my chest and out of my body for about 2 weeks. I probably should have kept the one drain in a little bit longer, but you know, I didn't. It came out early because I wasn't stretching my arms like I should have been. You know. Let's see. What are the side effects from all this surgery? Let's see. I've got a scar that goes straight across my back, roughly 8 inches long and 3 inches wide. I've got scars in my armpits, roughly 6 inches long each side, and my armpits are completely numb. See, it's hard getting used to the numbness, and it's actually gotten better over time, just because I'm getting used to it. But other than that, the next thing that I'll be talking about is starting interferon treatments, which is a pain in the ass. Alright, I'll see you next time.